Medicare is great insurance, but it doesn't cover everything. So let's break it down. If you have any questions about your Medicare coverage or health insurance in general, we are licensed nationwide, so you can of course reach us at the number on the screen or in the comments below. And of course, there is no charge for our services. Now, we do release these videos on a weekly basis, so to help us grow our channel and reach others who are looking for the same type of information, could you please make sure to hit subscribe as well as click that like button so that we can get this information out there? Thank you so much. All right, let's dive in. So although Medicare will provide truly comprehensive coverage, there are costs associated, such as premiums, deductibles, and copays and coinsurance. Many are surprised to find out that they have to pay for Medicare at all. And yes, this is the case. Now, most people actually don't have to pay for Medicare Part A. However, there is a monthly premium for Medicare Part B. In 2023, the base Part B premium is $164.90, but it can be more based upon your income. Now, in addition to the premium you have to pay to keep your insurance active, there are costs associated when you actually utilize the Medicare covered services. For example, first you'll have to meet your deductible, which is the amount that you have to meet out of pocket before Medicare begins to contribute to the cost share. Because original Medicare is split into two parts, Part A and Part B, there are two separate deductibles. So in 2023, the deductible for Part A is $1,600. Now, this is applied per benefit period, not annually. The term benefit period can be a little bit confusing, and we do have a video that delves further in depth regarding that benefit period and how the Part A deductible works. But basically, you can think of it as similar to a hospital stay. For example, let's say you had to be hospitalized for a surgery or procedure in January. Well, first you would have to meet that $1,600 deductible before Medicare began to contribute. And that's, let's say, later in that year in October, you had to again be hospitalized. You would again have to meet that $1,600 deductible, even though it's within the same calendar year. The Part B deductible is much easier to understand. In 2023, the Part B deductible is $226, and that is once annually. So once you've met that deductible, you're good for the year until your plan resets. If you are interested, there are Medicare supplement plans, also known as Medigap plans, that do help to cover that $1,600 Part A deductible, and there may be plans available to you to cover that Part B deductible dependent upon your age. And then there are also copays and coinsurance. This page on Medicare.gov breaks down the costs pretty thoroughly. So it's going to start with Part A, and if you scroll down past where it says deductible, it's going to break down costs for inpatient care, skilled nursing facility care, home health care, or hospice care. So for inpatient care, your copay or coinsurance is determined by your length of stay. So after you've met your deductible for days 1 through 60, there's actually no charge. If you stay there longer for days 61 through 90, there would be a $400 copay for each day. For days 91 through 150, it would be $800 per day. And after 150 days, you pay all costs. Now, for a skilled nursing facility care, which is more likely where you would be referred after your hospital stay if you needed extended care, for days 1 through 20, there's a $0 copay. For days 21 through 100, it is a $200 copay per day. And after 101 days, you would pay all costs. For home health care, there's no cost for covered services. Now for hospice care, it's actually $0 for covered hospice services. And luckily for these larger costs, there are Medicare supplement plans that help to cover that. Now for Part B, again, if you were to scroll down past the deductible, which is that once annual deductible of $226, it breaks down the costs. For Part B, it is easier to understand because it's pretty much always going to be $0 for preventative services and screening services, like your yearly depression screening or your yearly physical, and 20% for any additional type of Part B service. For example, if you need to go see a specialist, or if you're sick and you need to go to your regular doctor, but just because you're sick. And it's also 20% coinsurance for any type of outpatient care. So those are the financial gaps not covered by Original Medicare. Let's talk about some of the benefits not covered by Original Medicare. And of course, the best way to do that is to take a look at what is covered by Part A and Part B. So this page on Medicare.gov details what Part A covers. So Part A will cover inpatient care in a hospital, so if you have to be admitted into a hospital, skilled nursing facility care or nursing home care. Now this is not long-term care or custodial care. This is really just meant for short-term recovery, rehabilitative services after you've been an inpatient in a hospital. This is not for somebody with a long-term condition, for example, like Alzheimer's. It will also cover hospice care and home health care. And then there is Part B, which will cover medically necessary services and preventative services. Preventative services are usually going to have that $0 copay. So Part B will cover things like clinical research, ambulance services, durable medical equipment, so these would be like wheelchairs, walkers, etc., inpatient and outpatient mental health services, as well as partial hospitalization. Part B will also cover very limited prescription drugs. So it will not cover the prescription drugs that you take on a regular basis, perhaps to control your blood pressure or your cholesterol. You'll notice that that is a major benefit that is missing from original Medicare. And you may also notice that dental, vision, and hearing are missing from original Medicare. Since dental, hearing, and vision are not covered by original Medicare, many people think that a Medicare supplement plan will cover these benefits, and that is just not the case. Medicare supplement plans do not offer additional benefits that aren't already offered by original Medicare, so they aren't going to offer you dental, vision, hearing, or prescription drug. They are simply a financial solution to the financial gaps of original Medicare. So they will help to cover deductibles, copays, and coinsurance, and possibly impose an out-of-pocket maximum if necessary. So no additional benefits, just a different way to restructure the finances. Because original Medicare doesn't cover these benefits, many people look to alternatives for coverage. Now, something that was especially problematic in years past was hearing, specifically hearing aids, because these were not covered by original Medicare, and in fact, many private forms of insurance actually don't cover hearing aids either. Now, hearing loss requiring some type of hearing aid is extremely common, especially as we age, and unfortunately can be very isolating and very problematic if you're unable to afford a hearing aid. Luckily, hearing aids are now available over the counter at a fraction of the price. For vision, it's a little bit gray because Medicare will cover some medically necessary vision services like testing for glaucoma, but it's not going to cover something like prescription glasses. Luckily, private vision insurance is actually pretty darn inexpensive. And of course, dental is not covered by original Medicare. This is extremely problematic because proper dental care really is crucial to overall health. In fact, it's been studied and shown that patients being unable to brush their teeth while hospitalized is a leading cause of non-ventilator related pneumonia. Now, like vision insurance, private dental insurance is readily available and so much less expensive than many people think, because very often people are thinking of the costs of health insurance and thinking that things like dental and vision are going to be similar, when in fact they are a fraction of the cost and they will offer you much more flexibility. For example, if you wanted to go with a PPO plan for dental, that's going to be much easier to find with a private dental insurance plan as opposed to a Medicare Advantage plan that also offers dental benefits. We'll talk about that in just a bit. And as an aside, you could even look into a dental savings plan, which is not an insurance plan, so it's not something that we can really assist with, but they are readily available, and if your dentist will accept it, it could be a way to save money. So unfortunately, Medicare supplement plans, Medigap plans, will not offer coverage for these benefits. However, many Medicare Advantage plans do. Medicare Advantage plans are an alternative to original Medicare. They will replace your original Medicare entirely. They have to offer at least the same benefits as original Medicare, but from there, many plans will offer additional benefits to entice beneficiaries, things like dental, vision, hearing, prescription drug, and a lot more. However, we do urge you to proceed with caution because you are certainly giving up a lot by enrolling in a Medicare Advantage plan as opposed to original Medicare with a Medicare supplement plan. They can seem very appealing, but there are certainly drawbacks, especially with those restrictive networks, so please proceed with caution. And another major benefit not covered by original Medicare are prescription drugs. Now, this certainly comes as a very big surprise to many. Now, there are some exceptions. For example, chemotherapy would fall under Part B, so that would be covered by original Medicare, as well as many other anti-cancer medications, vaccinations administered in a doctor's office, as well as insulin if it's administered via pump. Really, any other type of medication is going to require a Part D plan, which are strictly prescription drug plans. Again, there's going to be an additional monthly premium to pay, and you may have a deductible to meet, and then there are copays and coinsurance, which are determined by the tier of your medication. There are 5 tiers. You should be able to easily look up what tier your medication is. Generally speaking, the higher the tier, the more expensive. So if your medication is tier 1, it's usually going to be much less expensive than a medication that is tier 5. Now, although yes, there are things that original Medicare doesn't cover, original Medicare really is great health insurance, offering you tremendous flexibility, especially if you can afford to enroll in a supplement plan as well. But if you have questions about your Medicare coverage, please feel free to reach us at the number on the screen or in the comments below. We are licensed health insurance brokers and we are licensed nationwide. And yes, there is absolutely no charge for our services. So even if you just have questions, please feel free to reach out and we will try our best to help. As a reminder, before you go, please click that subscribe button. It really will help us to grow this channel, and make sure to click that like button, most importantly. If you have any questions, if there's things that you feel like we left out of this video, let us know in the comments below. As always, thank you so much and have a wonderful day. Bye-bye.